Welcome to the Chief of Cybersecurity podcast, where we discuss relevant information surrounding protecting networks, devices, and data from unauthorized access or criminal use from hackers. Also, industry best practices and the cybersecurity workforce. Made possible by CMIS. Learn more at CMIS.net. For a list of publications, visit DwayneHart.com.
All right, welcome to Season 4 of the Chief of Cybersecurity podcast. Chris Casanova here, alongside Dwayne Hart. This is actually kind of a two-part series. We're going to be talking about healthcare and cybersecurity, where the intersection happens, and why healthcare facilities are attractive targets, vulnerabilities, as well as risk and rewards. So let's introduce our show host, none other than the Chief of Cybersecurity, Dwayne Hart. He's a best-selling author of the book Cybersecurity Mindset. Also a content creator at YouTube, speaker, Forbes contributor, and a popular host of the Chief of Cybersecurity podcast, Dwayne. And by the way, as you listen to this, you can check out all this content and more at DwayneHart.com. So Dwayne, welcome back to another episode.
Hey, thank you for having me on board here, because for this month, I have dedicated podcasts and all my writings to the healthcare industry. And here's why. Because healthcare cybersecurity is a critical topic. My audience, I want you to think about your patient records. I want you to think about your information and when you share it with your health providers. And also to think about the newer technologies that we have versus the legacy technologies that are abreast of us, and how all of those have to be cybersecurity capable. So let's go ahead and talk about some healthcare cybersecurity.
Absolutely. And so, if you ever visited a hospital or had the need, back in the day, it was, as we mentioned, quite an antiquated system. So the good news is, the advances of technology has been, phenomenal, and, miracles, short of miracles have happened as a result of technology and the medical industry. But the newest evolution is all of these connected devices, right? All the shared data, all the devices that are talking to each other, which allows amazing results in terms of communicating with, your health records across all types of spectrums. But, therein lies the challenges, right, Dwayne, with cybersecurity and, protecting that.
Oh, yes. There are some challenges. So I just want to tell my audiences one simple fact. We can improve healthcare cybersecurity, so please listen to us. Now, here's the reason why I know that we can improve cybersecurity in healthcare. Because it is at most important. Because we're dealing with health records, and also too, patients need access to those health records, but also the core of healthcare is about patient care. So when we look at patient care, we have to look at information sharing, because we have to look at medical devices, and also too, information sharing with the remote clinics, because now major hospitals and healthcare institutions have to share information with these remote clinics that may be in a distant location. Now, think about 30 or 40 years ago when everyone had to gather their health records, fax it into a doctor's office, or even carry it to a doctor's office, or even struggle to get the records so that your next primary physician could look over those health records and to identify how to diagnose certain symptoms, right? But now we can share that information electronically, but here comes cybersecurity, and there goes hackers, because we still have to protect that data. That's why we have HIPAA. And also, too, we have to think about patient care and trying to diagnose symptoms, because in the traditional format, medical doctors would spend a vast amount of time just researching data and try to figure out how to diagnose a certain symptom or to come up with answers for the medical community. But guess what? We have artificial intelligence now that can speed up productivity and efficiency to help out with the medical care industry, but also, too, thinking about artificial intelligence and how it works with the world of cybersecurity. It also helps us to secure medical devices and to secure certain enterprises. So when you think about the healthcare industry, I really want you to think about when you walk into a hospital and you present your personal information and what happens from that point up until you see your doctor.
Yeah, I mean, the rewards are almost limitless, right? The potential and also early diagnosis and, communicating across the country, across the world in real time. Whereas, and most healthcare was just all based on local. So whatever that local physician knew about your condition was kind of very limited, right? And now, in a nanosecond, this research that they may not be aware of can be right at their fingertips. So obviously, I think the consensus is the rewards far outweigh the risk, but the risk you have to mitigate those, right? You have to be aware of those, and you have to be one step ahead of the hackers or whatever, because there's, as we mentioned at the top of the show, healthcare facilities are an attractive target. I mean, why do you subscribe? Do you subscribe to that, and so why?
Well, we have to think that when we deal with the remote clinics, not so many of all of them probably carry the same cybersecurity standards as a primary core type of facility. Let's say, for instance, if we take one of the major healthcare institutions out there, like the Veterans Administration, and knowing that the Veterans Administration has clinics all over the United States, but guess what? The Veterans Administration has to communicate with these remote clinics that are probably located in distant places that don't carry the same cybersecurity standards. So how can the VA work to ensure that the veterans' health records are safe? And also, too, when this information is communicated to these remote clinics, how can we ensure that it's safe? So what happens is that it becomes important because we need to bring everyone to the same standard. Now, we know that the Veterans Administration is probably one of the organizations that is transforming and trying to bring veterans healthcare to a higher standard. Even so, looking at the CDC and some of the other healthcare institutions that are trying to come up to standard too, because all of these healthcare institutions have to share information. Because if you're a veteran and if you go to somewhere like Northside Hospital, your records are held there. But guess what? The VA may needs to see those health records. So, this is where information sharing comes to surface, because in the cybersecurity mindset, to all my readers, if you go to chapter 9, which is talking about information sharing for situation awareness, this is where we decide on certain factors when it comes to data. What are we sharing? When are we supposed to share it? How are we supposed to share it? And to whom we want to share it to, right? Because, see, we have to think about those measures because they apply across cybersecurity as well. Because hackers are lazy, right? Very lazy. So what hackers try to do is to find the weakest target. And just imagine a lapse in a software program that an healthcare institution uses, and there are vulnerabilities in that program where you have a leak with patient data. Or better yet, what if you have a medical device that have old antiquated software that has never been patched and updated, and it's not cybersecurity ready? Well, these medical devices are on a network as well, because when you go to a hospital, have you ever noticed that at a nurse's station, they can monitor patients that are down a certain hall and see what all the vital signs are? Well, those medical devices are on that network, and they are providing that information. So we have to make sure that these devices are safe. Now, that's where the FDA comes in and manage medical devices and their safety, because the FDA primary purpose is to keep the public aware of medical devices and their safety measures as well too. So as we look at this entire podcast and talking about healthcare cyber security, then there's a lot of moving parts.
Before we move to our next topic, you obviously you brought up the VA, which was instrumental in 2019. I don't know if it was reactive to this. The interesting that 2015 actually marked the year of the highest number of healthcare data breaches in the U.S. that equated to 122 million health data records were breached. And so, fast forward to 2019, that's where the VA actually transformed its health records and connected medical facilities with the Department of Defense, U.S. Coast Guard, and 60,000 community care providers. So, there's some good news on the horizon as well, right?
Yeah. Well, that's good news on the horizon because the VA is tasked to make sure that veterans are taken care of. That is their ultimate responsibility is for veterans health care. All right. So when we look at 2019 and going back and actually knowing that the VA was a centralized place that kept medical records for veterans, but also too veterans themselves came from different branches of the services. So what had to happen is that the VA had to have a communication link and to share information with the 5 branches of the services. So I cannot forget about the Coast Guard, right? So they had to make sure that there was something in place to share information. So as we see now, patients' healthcare is very important, and patient healthcare extends beyond some of the traditional things of just talking about data, but it's how that data is stored, who actually have access to that data, but also looking at the technologies that we use as well.
Dwayne, it's interesting you did kind of a deep dive into the VA, and they're being proactive. As recent as 2019, actually they transformed all their health records, and the new system connects now the VA medical facilities with the Department of Defense, U.S. Coast Guard, and 60,000 community care providers, which rewind actually in 2015, get your take on this, and then we might talk about ransomware as an element of this. But as early as 2015 actually marked the year of the highest number of healthcare data breaches in the U.S. that equated to 112 million healthcare data records were breached.
Wow.
That's a staggering stat, right?
Yeah, that's a staggering fact. But the reason why I think that healthcare institution was probably a target was because of the term being cybersecurity ready. Because a lot of times with cybersecurity, it's certain sectors and institutions that are not brought up to standard or pretty much not thought of as being vulnerable, right? Right. Even so, this is off topic, but looking at faith-based institutions like churches.
We actually did an episode on that on the podcast a while back, so listeners can reference that as well. Speaking of attacks, so we've, in previous episodes that I know you covered in your book as well, the whole issue and, challenge with ransomware. And usually when we hear the ransomware in the news and the headlines, it's always been, in the financial sector, right? And how that impacts our finances. And it's one thing to have, your credit card compromised or have a bank, or any retail outlet, that you're involved in or doing transactions with that when ransomware comes into place. But now let's get your thoughts on take it to another level, if you will, ransomware involving your medical. It's not exaggerated to talk about, life-threatening situations. And we're now, we talked about the top of the show, again, about healthcare facilities being attractive targets. If you can, hold captive an entire medical facility and they can't move forward on, urgent needs of their patients, that's very problematic.
Yes, it is problematic itself. But, what I want to do is to step the audience into a basic definition of ransomware. I want you to think about you having a computer and it gets infected with a ransomware and everything gets encrypted on that computer. And then there's a indicator that flash up and say, okay, if you give me $50,000 to this account transferred to either crypto, Bitcoins or whatever, I can unleash your computer. So take that same concept and apply that to a medical facility where you have patient records and these patients have been diagnosed, but the provider cannot get to those records to even make a determination on how to provide effective health care to those patients. So what happens is that the institution is held on the ransom now. Right. So the question goes, which is most important? You're going to give him $1 million or you got 20,000 patients who cannot access their medical records. So I would think that a lot of times I think ransomware do occur, and I think these institutions just probably pay it out because patient health is at most important. But at the same time, I think that one of the ways that organizations do work to at least counter ransomware is that they should be doing regular backups, right? In case your system get attacked with a ransomware, guess what? You actually have backup and storage ready because you can do real-time backups, right? Real-time backups is saying that in an instance when data changes, it gets backed up to a alternate server or something like that, right? Now that's one of the strategies to have in place. But the other strategy too is to just educate your staff on ransomware, because a lot of times when it comes to the healthcare institution, the medical providers and nurses only really use those systems for their intended purposes, right? Because it's a high op tempo environment, because they don't really have a lot of time to figure out A, B, C, and D because it's patient care. So what happens is that hackers take advantage of someone just trying to do their job, or pretty much they take care or they take advantage of the environment because they know that it's a high op tempo environment and patient care is the number one priority. When it comes to the IT systems and so forth, maybe it's a second or third priority. So they take advantage of weaknesses. Now, when it comes to somewhere like a financial institution, guess what? Systems are at the top of the chain and it becomes increasingly harder. So what we have is that a game of what I call psychology. Understand who you're dealing with and understand their weaknesses. Now, I think that because we have upgraded systems now and that AI is coming on board, it can supplement a lot of the IT work that healthcare professionals have to do and to worry about, right? Medical diagnosis is very important because in real time and pretty much a lot quicker than the normal period, these health providers can diagnose things like cancers, diagnose things that are happening to patients' health, and get a rapid answer. So,
and even with those in place, they can predict future illnesses or be proactive about it. But at the perfect segue, Dwayne, you just mentioned about AI, which is our potential last topic for the show before we wrap up this episode. But just want to remind our listeners again, Rich Casanova here with Global Podcast Studios. We're speaking with none other than the Chief of Cybersecurity, Dwayne Hart. And you can check out his podcast as you're listening to here. Check out his speaking engagements, his articles on Forbes, as well as his YouTube channel. That's all available at DwayneHart.com. So, Dwayne, maybe our last topic before we wrap up this episode. You kind of did a teaser on it, but let's talk a little bit more about how AI improves actually cybersecurity and some of these issues and challenges and threats.
All right, then. So I'm going to let the audience know that I have a recent article that I submitted to Forbes. It's called "The Secret Link Between Health IT Transformation, AI, and Cybersecurity." But in that article, I wrote about your question that you just asked there, because AI is there for real-time analysis, right? And AI itself can actually speed up the process and the time that it takes to analyze data, because clinical data comes in millions of feeds, right? So these medical providers and personnel that have to analyze the data has to go through so many records and to try to figure out how to come up with answers for the medical community. But what if we have a hybrid environment? And I call it hybrid because you have AI that does all the analysis and does all the calculation using machine learning and to figure out exactly what's happening and to provide a picture to medical providers, and medical providers can come up with the answers. Now, this is why I call it a hybrid environment, right? Because you cannot have a full-scale AI environment in healthcare. So that means that AI would be probably taking over some of those critical things like surgeries and so forth. But you don't want that to happen. So you need to have a hybrid environment where you have your decision-making is done through the AI platform. Well, you have the data for your decisions are done through the AI platform, but the final decision is made by humans. Now, as we go through the technology industry, there are some things that need to be known. When we have transformation, it's also going to allow us to have advanced technologies. And when we reach the advanced technologies like AI, that's how we improve patient care, records management, and to diagnose issues. And cybersecurity is kind of working on the bottom feeder of this, right? Because when we think about information sharing, and I want the audience to think about how much data that the CDC, the VA, and all these medical institutions have to pull on a daily basis, and how someone has to go through that data and exactly figure out something that affects the public. Let's just take this back to COVID-19, though. All right. Trends. Because I know everybody watched the news when COVID-19 was happening, and how these numbers came up and said that about 15% of the people in this geographical location had issues with COVID-19. And then it broke it down in saying that for certain categories, maybe it was people that was flying. Maybe most of the people had went to a football game, right? So that's a lot of clinical data. So if you take an AI platform and to analyze that information, it makes it easier.
Yeah, and fractions of incremental time that would take people in the past to do. So we're out of time at this point for this episode. So again, I want to thank Dwayne Hart for being here and his expertise, obviously, on this episode of the Chief Cybersecurity Podcast. So little teaser for our next episode in this series. We're actually going to be delving into the crucial role played by Cybersecurity and Infrastructure Security Agency, also known as the CISA, in safeguarding the public healthcare. So until next time, be safe, wear your hacker's hat, and we'll see you on the next podcast.
That's right. See you on the next podcast. And also remember that if you go check out chapter 2, 6, 9, 19, and 20 of the Cybersecurity Mindset, it applies to this podcast as well. Stay safe and rock and roll, my friends.
You've been listening to the Chief of Cybersecurity Podcast, where we hope you've gained knowledge to improve your cybersecurity mindset. Visit DwayneHart.com to learn more about publications, show notes, and more information on cybersecurity.